slightly different scan because this was a PET scan with the MRI. This is a different type of scan, so you can't compare directly, but that's your blood vessel there, the aorta, and there wasn't so much thickening around there previously, and the front here was clear, as you can see. So it is beginning to grow.
Because you thought it was slow growing.
Well, I still think it is, because you know, when I saw you over a week ago, you obviously had the nerve problem and that clouded everything, but now that that's been fixed, you're pretty much almost how you were back in May. However, we do have evidence that disease is beginning to grow. So it's still, I think, a slow grower, because it was 4 months ago, May, and if it was a fast grower, you'd be getting a lot of symptoms from your chest, you know, breathless pain and so on, and that's been pretty steady. So I would think, based on the tests we did, that your tumour would respond to the chemotherapy. I mean, there's no guarantees, but based on the work we've done, it should be sensitive to the chemotherapy. So I would still recommend chemotherapy as an option for you. I mean, that is the standard treatment. We will be having a trial, hopefully, but it's some months away, of comparing immunotherapy to chemotherapy, but that trial is not open yet.
Because we talked a little bit about immunotherapy when I came in before, and I talked about that place in Bethesda and their use of listeria. Oh
yeah. So that trial, I'm not entirely sure whether that trial's going ahead. They were planning to do that trial, but
here,
it's been
globally,
yeah.
Globally.
So we did put our centre forward for that trial, but it's gone onto the back burner at the moment. So they were comparing standard chemotherapy to chemotherapy with the listeria toxin. So we don't quite know if that trial's going to go ahead now.
Jenny decided she wanted to wait for this trial. What would your opinion be of that? Would you be concerned about the growth?
You could. Well, it hasn't doubled, but it has increased. What did the final report said? It said CT appearance are in keeping with progressive disease, with more extensive thickening, more extension into the upper abdomen, an increase in size of lymph nodes. So it is on the move. You know, realistically, I think that trial won't be open until next year.
So it's not a good idea to wait that long, you mean?
Yeah, I don't think so. I think you still have some time if you want to defer the chemo, but I wouldn't defer it to next year. You see what I mean? We could do another scan in 6 weeks and see how you are then. But you're coming to the point where we would be offering you treatment. I mean, at the moment, I think we should give you a little bit more time to recover from the operation.
Okay, I have two queries after that.
Unless you want to rush in with the chemotherapy.
No, well, I'm very aware of a lot of people I know have had chemotherapy, and you get so sick, and also it knocks out your immune system, doesn't it, chemo?
Well, that's an open question. There are some chemotherapies that work well with the immune system, so actually there are combinations of chemo and immunotherapy as well. But you're right, some do, but some don't.
Right.
This particular one, I don't think particularly affects the immune system too much.
Right, because here am I trying to do this diet, and I'm really working at that.
By the way, you're on the metformin, aren't you?
No,
not
yet.
taking.
No,
Oh, okay.
no, because I didn't get anybody to prescribe it.
Yeah, in fact, there was a recent study just published. I just remembered that that was in your GP's letter and showed no benefit with metformin.
Right.
In mesothelioma.
Well, I'm following what Dr. Flavin writes to me, and she's extremely well informed. She came to all these lectures and went to the mesothelioma conference, big talks and so on. So she's not any crank. She knows what she's talking about, and she's a pharmacologist. And she's worried about me and is suggesting certain things, and she explained to me when I saw her, when I was with your mum, Maggie, these particular things which she said would attack the mesothelioma particularly. And I could write to you and write it all out and send it to you and see what you thought about it. But it was all based on evidence and things that she'd seen. Or I could ask her to speak to you.
Yeah, that's fine. She's a pharmacologist, is she?
She's a pharmacologist and a doctor.
Where does she work?
Germany.
Yeah, I'm happy to talk to her.
Okay.
You give her my email. She advises you on what to take, does she?
Well, I've only consulted her once. I consulted because the first thing I did was talk to this woman, Sophie Savage, who wrote that book about working with cancer. Now, the other question I was going to... So you consult her. She's got a charity, an organisation called colmed.org, COLLMED.org. And then she talks to you on Skype. But actually I saw her in person. She spent a couple of hours with me and went through. She's incredibly fast thinking, so you've almost got to tape her and then play it back because you can't keep up with where her mind's going and all these things. But she's got a lot of mesothelioma patients now.
Okay. In
She's
Germany?
following through.
In Germany?
All over the world, I think.
But she doesn't treat patients with mesothelioma?
No, she advises them, and she's trying to say how you can use conventional stuff and what you would need in addition from alternative stuff. She hates this division between the two and thinks they should be combined, and that's her mission.
Good luck. Do you know how many billions of dollars you need to prove, all those different modifications to diet and so on? I mean, that's like just...
There's a lot of work apparently in China because they do follow from there.
Problem is
And
those
Russia.
studies are not done, and they're not rigorous studies, where you do
yes.
follow the Western scientific method where you give
Yes,
half
of
the
course.
patients
Sure,
X and
sure,
half Y.
Yeah.
Unless you've got a big drug company behind you, it's very hard. Even the NHS doesn't spend money on doing those trials particularly.
Yeah. So, I suppose they're going from what happens when they look at the chemistry and how it works through the brain and and then you try things, which is what we do with immunotherapy, isn't it? We try it.
Yeah, so we will have that immunotherapy trial that I mentioned, hopefully, but it will be next year. So it will be frontline, comparing 2 immunotherapy drugs versus chemo. And we will also have second line, so patients who've had chemo can then be randomised to either more chemo or immunotherapy. And there is the option of switching round if,
But immunotherapy, in your terms, is using another drug, isn't it?
Yes. We tested
So
your
it's a
tumour.
kind of chemo, though.
Well, it works on your immune system.
Right.
The immunotherapy. So we tested your tumour for the PD-L1 and it wasn't particularly high. So, rushing in with the immunotherapy, I still think for you, the best chance of controlling the disease is the chemo. The question is, when do we do that?
Yes.
I think we can afford to wait another month or so, repeat another scan in about 6 weeks, and then, depending on how things are, if it's still growing, offer you the treatment then. But I think waiting till next year might, there's a window of when you can give chemotherapy. If you miss that window and the patient's too weak to have the chemo, then, as you were last week, you were too weak to give you anything. If we gave you chemotherapy on top of this, that would have been a disaster. So we had to, good thing it was something we could easily solve.
Yeah. Brilliant surgeon, that guy, Ashwee.
Oh, fantastic, yeah. That's
Ashwee.
good. I don't know him, but he did a great
He
job.
looks about 25. I thought, well, he's got steady hands if he's that young.
Yeah, no, that's so that's the thing. There's a window of when to give chemo. Sometimes that window is quite large for a patient, sometimes it's quite small. I think, you do have another month or so to wait, particularly to recover from this. And you haven't got any more urine, just be careful you don't get any more urine infections, because I think that's what precipitated your fall.
How do I know if I've got one?
But Jenny's fallen 3-4 times since then as well.
No,
Well, that's because of the ongoing issues.
Okay.
Yeah, with the bleeding in the brain and weak foot and so on.
Right.
How do I know I've got urine infection?
Well, if you start getting...
I didn't have any symptoms
You
at
don't have
all.
any symptoms at all. It's difficult then, isn't it?
Can you do it with a litmus paper or anything?
You can sometimes. It'll do I think if you're prone to it, you should get your urine tested at your GP. Just drop in a sample
They
every
tested in a
month or so.
hospital, though, didn't they? This time?
I can't remember.
I thought you told me they did. Yeah. The GP will give you a bottle and you just do it yourself.
So in terms of your blood.
So can you do the immunotherapy privately?
Yes, I do it privately.
So wouldn't have to wait for the.
If you wanted to, yeah.
So you could also do chemo. If you wanted to do chemo, you could do it.
I could do the chemo with the NHS. I mean.
Yeah, but private. No, immunotherapy is not available unless it's either private or in a trial. We don't have any trials at the
So
moment.
if the trial is too long to wait, I could do it
Privately, if you wanted
But are you saying that from the PL something levels that immunotherapy may not be indicated?
You did have some PDL1, but it wasn't a very high. So the chances are not high you're going to respond. You could still respond. But it's only a rough guide. It's not a set in stone.
But I'm more likely to respond to the chemo.
Yes, yeah, and the chemo might then prepare the ground for the immunotherapy. So it might actually,
How would it do that?
by maybe boosting the levels of the PDL1 in the tumour, and also may affect the T cells in your tumour. So that's why people are combining immunotherapy with chemotherapy as well.
Okay. And sorry, just one more question. So, and the chemo, what will that do? Will that shrink the growth, and then you keep doing the 3-month thing to see if it's growing again? Is that?
That's it. Yeah, you give 4 to 6 cycles usually, and then disease goes into remission,
Right.
and then you follow up with scans and the patient obviously, and see how things are going. And if it starts growing back again, that's when we consider second line options.
Right.
Although there are still no approved second line options, but we do have, we do use other chemo drugs and so on.
Yeah.
That's why the immunotherapy is interesting. Will that become a second line option, or would it trump chemo? That's why this company's designed this, what we call frontline trial, to see if immunotherapy would be better than chemo.
The only other thing I know about is that Sophie Savage again, because we've made this group of people with cancer, her father is 84, had his mesothelioma operation. Is that they took a section out?
Yeah, so the surgery is, I think in your situation would be challenging.
Is that the aorta?
Yeah, exactly. Yeah, it would be very tricky.
Yeah.
I mean, there's a mortality associated with
Yeah.
surgery. Surgeons will claim they can, their surgery does give people more life and so on. But again, there's no randomised trial showing that. The trial that is there is a UK one published a few years ago. If anything, that showed doing a big operation, actually those patients did worse than if they
I read
didn't
that the
do.
guy who was doing it in
Professor Treasure was the...
Tom Treasure.
do anymore.
He won't do it anymore.
Yeah, so that was an EPP, which the Americans are very, big proponents of, but actually now, that was mainly 2 brothers in the US, one of them who was proposing this, called Sugar Baker. That sort of almost died a death, and now people are doing limited operations where they just try to strip the pleura away but still keep the lung in place, because those operations used to remove everything, the whole lung with the pleura and part of the diaphragm. So that was a big operation. So there are still proposals to do those trials to see whether surgery, my view is the patients that do well from the surgery are those who would have done well anyway.
Okay.
But they have at big meetings, you have the surgeons and other doctors, debating this constantly. It's a very hot topic,
Yeah.
Because the surgeons like to feel that they obviously made a difference for your brain. There's no question
Absolutely,
that if you hadn't had that, you would have died from the blood collecting on the brain. But when it comes to, the only operations that definitely are good in cancer are those where you remove the whole thing.
Yes.
By definition, you can't remove the whole mesothelioma. You're always going to leave something behind. So, if you follow that hypothesis, that they're already, it's the wrong it's the wrong treatment, because they can't remove all the disease. You're always going to leave some mesothelioma behind. It's going to...
Because it's in the lung.
Because it's stuck into the lung. Yeah. And even if you try and remove the lung with the EPP and so on, mesothelioma does spread into the bloodstream as well. So sometimes our scans can't pick it up. Sure, there will be a few patients in the world who will be 10 years or more after an operation, but to expose everybody to such a procedure when it doesn't give them any extra life what's the point?
And your guy who's made it 5 years, is he on a special diet or anything?
Manuka honey. He spends a fortune on Manuka
Oh,
honey.
does he? Oh, perhaps I'll try it as well then.
Yeah, he's fine. I see him every 6 months now. He's doing very well. He's got very thick mesothelioma. He's had no chemo, nothing. But he had this infection. I suspect it was when he had the pleurodesis, it got infected, and that did something to his immune system and his mesothelioma. I don't know. I don't think it's the Manuka honey, but anyway, that's what he takes every day.
So he's an advert for immunotherapy then?
He would be, yeah. He would be.
But he's not somebody that you're recommending chemo to, or you are, and he's saying
No, because he's very well and he doesn't.
Okay, even though it's thick.
It hasn't changed in 5 years.
Ah, okay.
Yeah, I mean, your scans, we've seen a change now.
Right. Okay.
You know, so I think that your disease is on the move.
Okay.
Although you're not experiencing much in side symptoms, which does suggest to me it's still a slow grow, because if it was a fast grow, it would have, tripled by now in size compared to May. It hasn't really, even in some places, hasn't doubled. So, sorry.
Sorry, doctor, this patient is not in the system. So
Okay, yeah, that's fine. I'll see him in a minute. Yeah.
can I leave this?
Yeah, that's fine. Yeah. Okay.
Thank you.
And where would, if Jenny was experiencing pain, would that be in the chest and breathing? I mean, what
Yeah.
what
I
does
mean,
she-
you don't have to get pain.
Right.
You could just get breathless and
Right.
tired.
Okay.
Yeah. But looking at you now, as when I saw you back in May, June, you're no different now. So
Okay.
you're actually what I call stable.
Yeah.
Yeah.
You weren't last week, but we know what the cause of that was.
Yeah.
So I think you have. I'd probably see you in again 5 weeks or so.
Okay.
5-6 weeks. Repeat another scan in 5 weeks, and then make the decision. Then, well,
I'm going to go and
Chemo,
I'll ask
if
Donna
you wanna
Flavin
go
to
for
write
that.
to you.
is that all right?
Yeah, and if it's okay, she writes to you.
Yeah, that's fine.
Do you have any information on the types of chemo?
There's only one type of chemo we give, so it's 2 drugs called platinum and pemetrexed. The platinum can be a long version or a short version. There are 2 types of platinum. The short version, the advantage of that is it's only an hour's treatment compared to 6 hours. And you trade off kidney, nerve damage, side effects for a bigger effect on the bone marrow. So that's the main
You
difference.
mean it has kidney side effects?
Well, it can do, but usually it's safe. I mean, your kidneys, your blood tests are fine actually. So I would still offer you the longer treatment, because
6
I think
hours.
you're fit for the longer treatment, than the short treatment.
And the other drug?
The other one, pemetrexed, is an antifolate drug. So you need to take folic acid every day with that, so sort of like a vitamin with B12 vitamin
Oh,
injection.
she wrote to me yesterday, Donna Flavin, and said take B12.
Yeah. So.
So I'll take B12 between now and I see you again.
Yeah, so I would book you an appointment for the October the 12th. Is that okay?
Mm-hmm.
And if you're getting worse, then if you could let me know,
Yeah.
then I'll see you sooner than that.
Okay.
Okay.
So will Jenny have the scan on the same day, or?
I'll book a scan for that day.
Okay.
So
On
in
that
the
day,
morning,
I
yeah,
don't-
again.
I don't see you in the afternoon.
Yeah, but if you're getting worse, please don't wait. Just let me know.
Getting worse by not breathing as well.
Yeah. Do you have my email?
Any other symptoms like weight loss or?
Yeah, anything like that.
Oh, I lost it. They weighed me this morning. I've gone down to 45.9.
Wow. Actually, you are little. You must be-
Yeah, I mean, I think we are looking towards chemo, as I said. Okay, you can always contact the nurses as well. Do you have their numbers, the mesothelioma
I must
nurses?
have it on the letter.
Okay, yeah, so you could always contact them,
It would be on the letter.
and we could see you sooner.
All right.
Okay, so I'll book a scan for you, and then I think we should probably start treatment in October.
Okay. Thank you for being so nice to me.
Okay, you're welcome. Well, I'm glad we managed to sort out the immediate problem last
Yeah,
week.
well, that
It
was
wasn't
brilliant.
as
You're doing well.
serious as I thought, it would be.
Yeah.